Good morning and good afternoon, ladies and gentlemen, wherever you are. I'm Vanessa Seeballuck from the University of Technology in Mauritius, and together with my colleagues, Dr. Nidesh Ramphal and Dr. Manish Patiraj, we conducted a study on exploring medical tourism in Mauritius, doing a SWOT identification of challenges and opportunities. For those that do not know where we are located, this is a quick picture of where Mauritius is. As you can see, it's just below, it's supposed to be below the Tropic of Capricorn. When it comes to medical tourism, in 2019, the medical tourism industry was soaring with a staggering market figure of approximately 104.6 billion USDs, and this is actually expected to grow more by the year 2027. If we had to define what medical tourism is all about, it relates to the transboundary movement of people to have access to medical facilities and services, to essential and non-essential services. This market has taken much of an ascension as reflected by the World Tourism Organization and the European Travel Commission. When it comes to the Mauritian context itself, we have a very impressive track record when it comes to being an upmarket tourist destination focusing on Sunshine Sea. And we are gradually transforming ourselves into a leading medical hub in the region. Data has actually shown that 18,000 foreign patients traveled to Mauritius for medical purposes, resulting in treatment valued at around 2 billion rupees. However, Mauritius medical tourism sector is facing quite a fair amount of competition from Asian countries, but also challenges in its growth and development in the local context itself. So what are the main factors that drive people to embark in medical tourism? First of all, we saw that people seek for services and expertise. The worldwide access to a number of treatments ranging from cosmetic surgery to organic transplants provided by specialized centers with the most qualified practitioners is what people seek for. Second factor that we saw that led people to seek for medical tourism transboundary is the cost issue. Southeast Asian destinations are appealing to medical tourism customers because of that relatively low cost for them, the medical services that they provide. And of course, another issue with regards to cost is that disparity in currency conversion. Furthermore, there are certain procedures that are not covered by health insurance in the home country of the people seeking for medical tourism. They are very expensive in their home country. Therefore, the option is to opt to go across international boundaries to have recourse to medical services. And a third driver is the legal and ethical implications. In certain countries, abortions, gender reassignment are not permissible. And even when it comes to organ transplantation, issues exist or prevail when it comes to priority lists. And some people have to have dire need of organ transplantation, therefore have recourse to going abroad for medical services and interventions. Other factors, therefore, that drive people to embark into medical tourism comprises of the absence of technology in the country that can cause barriers to having access to good medical services, specialized and commercialized transport facilities that deal with carrying people that require medical attention, destination attributes, especially those that are, warm countries such as the island of Mauritius, marketing exposures to much sought medical services, accreditation, regulations, and patient safety, and technology and medical supplies that are available, new technologies that are available at the destination and not necessarily available in the home country of patients. So the aim of our study was prompted by the examination of the inhibiting and facilitating factors towards medical tourism growth in Mauritius. The objective of the study was to carry out a systematic analysis of the Mauritian medical tourism sector using the SWOT framework. We looked at identifying delimitors to increase the market efficiency and performance, and formulate bespoke recommendations to support the sustainable growth of medical tourism in Mauritius. The methodology that was adopted was mostly qualitative data collection with semi-structured interview design, a sample selection and interview process, and a data description and clustering. We had recourse to 4 private healthcare institutions that were randomly selected from a list of private healthcare institutions we got locally. 3 individuals from each of these institutions were respectively interviewed, and a total of 12 participants were recruited and took part in the semi-structured interview, which took around 10 days to complete. Once the data was collected, it was analyzed using data parsing, coding, and analyzing in a blinded manner as per the figure that you are seeing on your screen. And this actually helped to cater for unbiased assessment of the transcribed data. So what is the result that we got in terms of strengths, weaknesses, and opportunities and threats? First strength that Mauritius has is its location. It can be seen as a turntable in the Indian Ocean, connecting Asian and African countries. Second main strength is that we are considered as one of the safest countries in the African region, ranked 3rd, in fact, in the African region. Another factor, another main strength is the services and quality of care that is available in Mauritius itself, with reduced waiting time and international recognition of care providers, and the socio-ethnographic stability of our island. We are a multicultural destination that is bilingual, so we speak fluent English and French, and even sometimes some people are very well versed in other languages such as Hindi or Chinese or Urdu or even Spanish. The weaknesses, strengths, of course, don't come alone. They come with some weaknesses that we have identified in our study. These weaknesses are associated with costs of our standard of living, and sometimes this amplifies the expense for our patients and the people that come with them. Medical coverage as well, when it comes to transboundary insurance, is not properly established. Therefore, this can pose a weakness when it comes to people traveling for medical treatment. Another weakness is our legislative framework, which does not cater for marketing of medical services via international forums, making us not so well known as a medical tourism destination. And a last weakness that we've identified was a lack of bilateral agreements that would have actually helped in facilitating the movement of patients in and out of the country for treatment. Moving on to the opportunities that we've actually identified. First, the opportunity is that of branding. We can actually brand the island as a destination that specializes in treatments such as rehabilitation. Another opportunity that we looked into and found that we could look at government-mediated incentives, that is, attract more specialized medical service providers, hence building on our capacity to provide specialized care. And a third opportunity that we've identified is that of digital innovation in healthcare. We can strengthen the IT infrastructure to provide remote assistance through e-health and support cutting-edge technologies, for example, the 3D printing of prosthetics. A threat that we've identified, a few of them actually, is the first one being that of competition. We have countries such as in Asia or even the Middle East that are growing very fast when it comes to medical tourism. And they have and not only is their medical tourism growing, but they are also very well established when it comes to a tourism destination itself. Another threat that the medical tourism sector may face in Mauritius is that of the misuse of levied transboundary access, that is money laundering or trafficking through illegal operations. And of course, it's undenying when it comes to COVID-19. With COVID-19, there is a decrease in transboundary movement and capital investment in the medical tourism market. If we look at the Mauritian situation, since last year, March 2020, our borders have been shut to international air traffic, therefore representing a decrease in arrivals for medical tourism. And it's still the case as at now. So what is the way forward when, based on the findings of our research? First of all, we saw that we could better advertise and promote Mauritius as a major player in the medical tourism sector in the African region. Further, we need to improve our air connectivity, especially with the African continent. We do have, but it needs to be reinforced. Third way to go forward is to better collaborate with the hospitality and medical tourism sector, as well as insurance companies. Therefore, this will give an incentive to people seeking for medical tourism abroad to consider that particular option, because they know that the insurance company will also cover the costs, some of the costs of their surgeries. And fourth is the development of a national tourism policy for medical tourism in Mauritius. So when we go back to the drawing board, especially after the COVID-19 situation, transboundary traveling has been brought to a grinding halt, and that's been the case across the world and has had significant impact on medical tourism, not only in Mauritius. We saw this being particularly obvious when it comes to Thailand itself, which have reported a drop of revenue of about 94% in 2020 with respect to medical tourism. COVID-19 has devastated the whole medical tourism ecosystem because of all the uncertainty over travel restrictions and quarantine measures that keep changing across the world. Currently, the situation in Mauritius is that when you do travel to Mauritius, for those that are allowed to travel, because not everyone is, it's mostly reserved for people or Mauritians that are stuck abroad and want to come back to the country. They have to go through a 14-day quarantine period. Last year, we are back into lockdown this year. We had a bit of a leeway last year by June time up to March this year, where we had partially reopened our borders, but now we had more COVID-19 cases on the island since March, and luckily the numbers have dropped significantly over the past few days. We haven't had any positive cases. So in this connection, once we are going to open our borders again, we need to think, is it time to capitalize on the near achievement of COVID-19 safe countries as a preferred destination for medical tourism through aggressive marketing? That's one question that we need to ponder over, and I think can actually take advantage of this, really. So to conclude, Mauritius has a very big potential to be a major player in the medical tourism sector, as it needs to create awareness about its strengths and deal with the weaknesses to take advantage of opportunities available in the African region. Well, thank you very much for your kind attention.